Welcome back to the Morning Blend. Sports fans were shocked to find out that Serena Williams was in the hospital with a pulmonary embolism. In other words, it's a blood clot that traveled to her lungs. For healthy people like her, the problem usually starts in the lower leg, and the tennis star recently had surgery on her foot, which could explain that problem. And it's a serious example of a vein problem, and it demonstrates too why it's so important to have an expert examine your veins and treat them.
And Dr. Deborah Manjoney is with the Wisconsin Vein Center and MediSpa. And first, we need to say hi to you, but also that it's DVT Awareness Month in March.
That's exactly right. And I was on at the end of February, and we talked about deep venous thrombosis, we talked about pulmonary embolism, and it just was actually very good timing. And of course, we didn't expect anybody like Serena Williams or that kind of public figure to have an issue, but like David Bloom did several years ago, a pulmonary embolism can be a fatal problem.
And what's I think shocking about it is in David Bloom's case, for example, he was the NBC reporter, he was covering the war, he's 39 years old and healthy by all accounts. A lot of people feel like, I know he had pain in one leg, and a lot of people will say if it's a healthy person, especially if the person's a little bit younger, or like Serena Williams, an athlete, and they're healthy, that it sometimes originates in the lower leg, but then it's once it travels that it's a problem because it can go to the lungs.
That's exactly right. In most people, it does originate in the legs, but they may not have symptoms even. And especially we see that in travelers. People who can develop blood clots that go to their lungs and they don't realize they have them in their legs after a long car trip, and especially after long flights on airlines.
Well, and Serena was saying on the Today Show today that she, after she had foot surgery because she stepped on glass or something like that, she had a boot on and a cast for a while, and she was doing a lot of traveling by plane, and that could have been
and of course she does a lot of long distance travel, going from California to Australia. Those are the type of flights where people have the problem. With pressurization on airlines, when you're on the flight for a long time, a lot of people get swelling in their legs, and that's the fluid within the veins going out into your soft tissues. So the cells, the red cells, are left behind and can be more likely to be thicker. The blood's thicker and you can form a clot more easily. Plus that inactivity of sitting still in a very confined space leads to other problems in the deep veins in the legs.
That's amazing to me. And what struck me the most about what you said earlier is the fact that you said sometimes there are no symptoms.
That's right.
So if that's the case, how do you even know to go and get checked? I mean, what should people know, and what should they do?
There are certain people who are at higher risk than others for developing them. Young women on birth control pills, women who are pregnant, people who have cancer, people who have any kind of potential to have more clotting problems, like there's some hereditary things, or people whose families have had a lot of clots. They may be more at risk. Anybody who's going to travel a long distance if they want to reduce their risk, should actually wear a knee-high graduated compression stocking. And you know, they're easily available nowadays, and it's something that will reduce the risk. And there are always studies going on to look at this kind of thing, but nobody's been able to conclusively say that like a long distance flight does it versus being in a car for a long period of time. But there have been studies that have shown that if you wear the knee-high compression sock, you're not going to have the clots in your legs, even that are silent, that can be picked up in people who don't wear them.
I want to talk about spider veins and also show some video that you sent to us. And this is of a laser treatment, and this is a way to treat spider veins. But can spider veins be a problem with what we've been talking about just now?
Spider veins are obviously the most simple form of vein problem that we see, and this is considered in most instances cosmetic. However, spider veins can indicate that you've got a problem within your superficial vein system and a backup, and varicose veins, even if they're not visible. And that, believe it or not, varicose veins is another risk factor that can be a cause for deep venous thrombosis because the valves in that vein aren't working, and blood can clot off in the superficial vein even more easily because it's distended and the blood flow is slow, and it can travel up the leg and get into the deep system, which then can be a problem. So yes, it really is all connected. It's a range, it's a spectrum of disease, and spider veins, although purely cosmetic for the most part, we often investigate whether or not somebody has more of a vein problem when they come in with spider veins. It kind of depends on the distribution, but we're really very aware of what else can be causing these spider vein problems, so we want to look.
Can you tell just by looking at somebody's leg with the naked eye if they're going to have more problems because of spider veins?
Not usually. Very often we'll have to do a venous duplex ultrasound, which we do at our institution, to look for other vein problems to see what else is causing them, and that's certainly the safest approach. Once in a while we'll see somebody who has just a little tiny bit of a spider vein, so we don't bother to do an ultrasound. But for the most part, if somebody has extensive spider vein disease, we'll actually recommend they have an ultrasound to make sure there's nothing else going on.
Better safe than sorry.
Right.
Yeah, so it seems like the point then is if you have even spider veins, something that you think looks like just maybe a cosmetic problem, it's worth investigating, because you know the average person can't tell whether or not
That's right.
it's a sign of a more serious problem, and even you need to investigate further to decide if it's something that should be treated.
That's right. Now, and the other thing people have to remember is your legs don't feel heavy at the end of the day just because you've worked hard or stood all day. Frequently that's a sign of vein disease. You know, if you've got pain in your legs every day, by the end of the day, if you get leg cramps at night, if you feel like you have to put your legs up when you get home at night, these things frequently mean you've got a problem in your veins. So you don't have to feel that way. You can have it investigated, and then we can work from there.
And that's the time to call. So here's the information so that you can contact Dr. Deborah Manjoney or one of the specialists there. It's WIMedispa.com is their website for the Wisconsin Vein Center and MediSpa, located on Georgetown Drive in Pewaukee. The phone number is 262-746-9088.
And just a reminder, our newsletter this month is about DVT and pulmonary embolism, and if anybody would like one, they can go to our website and click on it to read our newsletter and learn a little bit more.
Great.
It's great.
Important stuff.
Thank you.